Patient rights. Patients have rights, and many of us do not know our rights. Patients are being abused daily, and they are made to pay the ultimate price, death. Now, a woman by the name of Mrs. Mimi Imbol lost her 2 months old twin at a Roundup General Hospital in Lagos. Now, the nursing mother had visited the hospital's mother and care child unit with her husband, Mr. Kelvin. They went there to run a test on their daughter, who, according to Mimi, wasn't eating well. Now, according to a post on Instagram, they took the child in on a Wednesday for checkup, and the doctor told them that the child was okay after examining her, and that they will run a blood test to confirm if there was an infection. Shortly after the blood was taken from the child, she started crying profusely for 2 hours, according to the mother. They called the attention of the doctor, and the child was immediately placed on oxygen in the ER. The child was then said to be responding well to treatment until Friday, when the doctor asked Mimi to breastfeed the child, claiming that she was stable enough to be breastfed. Now, the girl started crying again after she was breastfed, and Mimi, according to her husband, ran to the nurses to get help. Now, in her words, he said that she was disturbing them. Even with tears and pleads, they sent the woman away, saying that she was disturbing them too much. Only when the child died and the woman started wailing did the nurses attend to her. Now, I know that there could be little or nothing the nurses would have done, but the attitude is everything. The attitude may have hurt the mother more than the death of the child. Welcome to the health show. I'm sorry for sharing that sad news for you, but remember to like, subscribe. And today I'm going to be talking a very important topic, which is patient rights. Stay tuned. The case above is a sad one, and many of them like that are on the internet. And people are being maltreated even at the point of emergency care in some public hospitals. Another study by Sola and Gabriel by Vanguard News reveals that unspeakable horrors happening within the four walls of the Lagos General Hospital. Though this article was published in 2016, not much had been said to have changed, and this should give us the insight into the things as they were. Now, these men carry out the research to investigate the situation of the healthcare system using the Lagos General Hospital as their case study. Now, they interviewed some of the patients, and the responses they got is a thing of serious concern. The research made it clear that the average patient is confronted by endless waiting, inhumane environment, bad staff attitude, and unmarked service points. Now, this goes on to say that there are many people who don't know their rights as citizens, not to talk of their rights as patients. And the Patient Bill of Rights was first introduced on the 31st of July 2018 by the Vice President Yemi Osinbajo. The bill was also championed by the Consumer Protection Council (CPC) and the Federal Ministry of Health to protect the Nigerian patients and ensure ease of access to quality healthcare. Now, these 12 rights are there to make sure that the average Nigerian patient enjoys his or her right and quality healthcare. They are in no permanent order. Now, these are the there is a right to relevant information in a language and manner the patient understands, including diagnosis, treatment, and other procedures and possible outcome. So the patient has a right to know the disease, the treatment plan, and the possible outcome. I think at this time it is safe to say that the private hospital just left this group. Now, there is a right to timely access to detailed and accurate medical records and available service. Timely access? I don't think so. Now, there's a right to transparent billing and full disclosure of any cost, including recommended treatment plans. Private hospital will never give you a transparent billing. Now, there is a right to privacy and confidentiality of medical records. While many hospitals practice this, yet they are still far from getting them. There is also the right to clean, safe, and secure healthcare environment. This, at least, should be the basic. But some government hospitals I saw in the eyes. Literally, it's like living in the gutters. Now, there's a right to be treated with respect, regardless of gender, race, religion, ethnicity, allegations of crime, disability, or economic circumstances. Well, nurses and midwives ought to take note of this. Let me see my lips because I train nurses and I also train ones that have sense. Another is the right to receive urgent and sufficient intervention and care in the event of an emergency. This is common sense anyway. There is a right to reasonable visitation in accordance with the prevailing rules and regulations. Another right is the right to decline care subject to prevailing laws and upon full disclosure of the consequences of such decision. There is a right to decline consent to participate in medical research, experimental procedures, or clinical trials. There is a right to quality care in accordance with prevailing standards. Lastly, there is a right to complain, express dissatisfaction regarding services received. Now, a man shared a story of how he got a text message on WhatsApp. Now, hear this. It was a broadcast message, and he quickly identified the sender as a small business owner that came to advertise their product during his visit to the hospital. Now, this man, very wise, he remembered that he didn't share this number with this man. So, how did he get it? It soon dawned on him that the hospital management must have been responsible for it. So, he had suspected that they probably leaked his record file to this business owner, and he called the hospital to complain. He told them how that they have violated his patient's right to privacy and confidentiality of medical records. Surprised and stricken, the hospital management apologized to him. Now, they also gave him compensation. But with this example, you can see how important it is for you to know your rights. It is obvious that Nigerian healthcare workers violate patients' rights almost all the time. Now, another example is when Farmer News Online spoke with Khadija, a petty trader from Agege, on a visit to Lagos. Now, after being referred from Orele Agege to General Hospital early in 2021, the woman complained that one of her appointments, her consultant refused to tell her the purpose of his medication, which is a violation of her patient's rights. According to Khadija, on getting to the pharmacy, I was told that that was not the right dose for me, so I was sent back to the consultant. He later realized his error and corrected the prescription. Now, these are just some of the many cases happening every day in different hospitals and healthcare centers in the country. Now, some of these staffs, especially the nurses, are reported to be very rude, unprofessional. I remember I trained nurses and I trained obedient and good ones. In fact, some women have shared their preference to having their babies in local maternity houses and health centers than in public hospitals. Now, this is because of the rudeness and wickedness of the midwives in some of the public hospitals, which is simply denying these women their rights to be treated with respect, regardless of their gender or age. Now, this begs the question: is it that these healthcare workers are oblivious to the patient bill of rights, or they are just simply being wicked? Now, if you paid attention, you don't need to know all these rights to violate them. If you just have a common sense of human care, you should not violate any of these rights. For instance, it is common sense for you to be calm and respectful to your patients, but some nurses and midwives will not. It will be important for you to note that some of the public hospitals are doing great when it comes to providing healthcare services to patients. One of them is Federal Medical Center, Ebutemesa, where an undercover reporter was sent to report on the services of that center in early 2020. Now, the results were refreshing as it made clear that the hospital's healthcare services were impressive. Now, patients were attended to on time, payment services were swift, tests were carried out properly, and the staff were nice and welcome. Now, it is important for you to note that not all staff in the hospital are terrible. There have been reports of some zealous staff, especially some nurses and doctors. They are very cool hospital workers. Some cite the challenges in the hospitals like poor working condition, fewer staff, and poor salary as a reason for the irritable state of hospital staff. But that is not enough. These challenges do not permit or give room for you to violate or deny a patient their rights. Now, to help improve the situation, this is what I recommend. Firstly, there should be a form of internal self-regulation among hospital staff. Now, there's also supposed to be continuous orientation of hospital staff on the patient's right and how to handle patients, especially patients' excesses. Now, some hospitals have this process. See their staffs being calm at the most wild situation. Secondly, litigation. I believe many patients let go because they are unaware of their rights. As that man I cited earlier, as many of them are now becoming aware, they can sue health workers and that treat them badly. This is necessary as until it starts happening, we may never see sanity in our hospitals. See, being a health worker is a noble profession. It does not just take knowledge. You have to be a doctor in knowledge and in character. The more reason why you will not hear a pharmacist fighting or asking or smoking in the office. We are calm. I know we are calm. I know some health workers are out there. Ezekiel, stop. Why are you telling these patients you're right? Well, it is necessary because one day you will be a patient too. And just then you will realize how important it is for you to be treated right. Thanks for staying with us. Before you go, we want to like, subscribe, and share this video among your friends for them to be able to know their right. Thank you.